Dr. Vivek Murthy is recommending warning labels linking your six-pack or your bottle of wine to cancer, just like you'd see on a pack of cigarettes. But what are the health risks of moderate drinking? Joining us to examine the evidence is Dr. Ngozi Ezike, former director of the Illinois Department of Public Health and now president and CEO of Sinai, Chicago. Welcome back to the program, Dr. Ezike.
Welcome. Thank you for having me. Happy New Year. Pleasure to be back.
Same to you as well. Now, here in studio, we've got primary care physician Aashish Didwania, vice chair of education in the Department of Medicine at Northwestern's Feinberg School of Medicine. Welcome to Reset, Doctor.
Thank you. Happy New Year.
We are coming off the holidays, and, many of us were eating and drinking in excess. So I'll start with you, Dr. Ezike. Just remind us what the current recommended guidelines are when it comes to drinking.
Yeah. So, there's always been recommendations for moderation. I think for women, it was a glass, and men, two servings. We should say servings as opposed to glasses, because a serving is a shot, it's a beer, it's a glass of wine, standard pours. But these new information that has come out just suggests that in addition to there being, considerable number of dangers associated with traffic fatalities and other car crashes, that there's also a cancer link, that this is the third most preventable risk factor in terms of preventing cancers, and they've linked it directly to 7 different types of cancers. Mm-hmm. And so that's just another reason for people to be aware of, the potential consequences that can come about from our alcohol consumption.
Right. Yeah. They've linked it to 7 different types of cancers and tens of thousands of annual deaths as well. Dr. Didwania, there's no question that heavy drinking is harmful. I think most of us know that at this point, but what are the health risks of moderate drinking? Talk more about that.
Yeah, that's a great question. That's really the question of the moment and what this report's kind of getting at with moderate drinking. So as Dr. Ezike commented, the big news is around the risk to cancer, driving these 7 cancers: oropharyngeal cancer, laryngeal cancer, esophageal cancer, breast cancer, liver cancer, and colorectal cancer. Mm-hmm. And the Surgeon General did a really nice job describing relative risk and absolute risk of moderate alcohol consumption in these cancers. And a number that you can kind of hold on to from that is a 10% increase by increasing your drinking 1 drink a day. So if your lifetime risk of breast cancer is 11%, which is the estimate for the average woman, if you're a moderate alcohol drinker, mm-hmm. 1 drink a day, that risk increases by 10% to 12% in your lifetime. Mm. So the relative risk sounds bigger, 10%. The absolute risk sounds smaller, 1%. They're both a description of the same thing.
Is it just a misconception that a glass of wine each day could prevent heart attacks?
Oh, you're asking the good controversial questions. One of the takeaways I have from this is that nobody should think drinking is healthy. We're wrestling with, is it unsafe? So the idea that I'm drinking 1 to 2 drinks a day to improve my heart health is based on observational data that few people believe.
Where did the myth come from?
The studies on alcohol are challenged by them being observational data. So in observational data, you have confounding variables to make it hard to prove causation. So you can say people that have 1 or 2 drinks a day have better heart health over their lifetime. What you're missing is, are they doing other things? Is the demographic that has 1 to 2 drinks a day doing other things, like they're exercising in a different way? Is their sleep patterns different?
Yeah.
Do they consume processed red meat or smoking in different patterns? Those studies might have confounding variables, and very few people believe that having a little bit of alcohol helps your heart. Mm. And we're challenged by the fact that these studies are not randomized controlled trials, they're observational. And so the links that we make, we have to be careful in interpreting.
Dr. Ezike, I want to ask you a question that we got from a Reset listener who emailed us this morning, knowing that we were going to have this conversation. Megan writes, she says many studies on this, they show that light or moderate alcohol consumption, it doesn't control for, they're innocuous and they don't control for socioeconomic status. And she says once you do control for socioeconomic status, then light and moderate alcohol consumption is shown to increase your likelihood of cancer or premature death. Can you speak to that?
Yeah, I know that's very technical. I think I like to think of it just on a broader, higher level.
Yes.
I think we can parse things out and say, if you did a randomized controlled trial and if you use this set of subjects versus this and socio control for this factor, that factor, I think at the heart of it, we have understood for a long time and known that alcohol is a carcinogen. We know that. I think we've definitely known about the risks associated with liver and liver disease, liver problems causing cirrhosis. We know the difficulties it causes just with things with sleep, the extra sugar and its connections to diabetes and increased weight gain. And so now understanding that it has this other untoward association, I think it's just information that people need to be aware of and then decide what they want to do with it. I think informed decision making is really what the goal is here.
Mm-hmm.
And I think understanding that it is not likely beneficial. We can argue and split hairs over how much harm it can cause and in whom it can cause this percentage increase of this cancer. But overall, we know there are significant dangers associated with it. It's not telling everyone to stop drinking, and we're not trying to go back to the prohibition days, but people need to be aware. I remember once upon a time, there was a lawsuit because somebody got coffee and spilled it on themselves and it burned them, and they said, I didn't know it was going to be this hot. And they had to put labels that,
Yes.
The contents of this cup,
Right.
may be very hot and can cause injury, right? And so it was like, okay, you needed to be informed. Be ye informed. Be more informed that this is dangerous. So govern yourselves accordingly.
Right. Now, every 5 years, the U.S. Departments of Health and Human Services and Agriculture, they update the U.S. dietary guidelines, recommendations on what Americans should eat and drink to be healthy. Those guidelines are going to be updated this year. Alcohol recommendations, though, they haven't changed since 1980. So, Dr. Ezike, could you see that changing this year?
Yeah, I think it could. As we do more and more research, as we learn more, new data becomes available. And so we need to, when you know better, you should do better. And so we should update with what we have. Absolutely. We get more sophisticated in our research, which allows us to know more. So I think we should continually be looking at things that we have accepted as just that's how it was and see if the data still bears that out.
Right. If you're just tuning in, this is Reset. I'm Sasha-Ann Simons. The U.S. Surgeon General is recommending warning labels on alcohol, just like you would see on a pack of cigarettes. And so we are talking to a pair of medical experts here to examine the health risks of moderate drinking. On the line, we've got Dr. Ngozi Ezike, who's president and CEO of Sinai Chicago. And in studio, we've got Dr. Aashish Didwania, who's a vice chair of education in the Department of Medicine over at Northwestern's Feinberg School of Medicine. So, Dr. Didwania, as I just said, this is going to be just like we see on a pack of cigarettes. Do you support that? A cancer warning label on alcohol bottles?
I support it.
Yeah. Why?
I think it's information and education the public needs to understand, and it'll at least generate the conversations people should be having with their healthcare provider. And as Dr. Ezike pointed out, we could nitpick about all the studies and the percent, but understanding that there's a link between alcohol and cancer is a very important take-home from this. And while there's a lot of debate in this current report and the news about moderate drinking, the reality is there's still far too many people heavy drinking. And this will allow primary care physicians like myself and my colleagues to have open conversations with our patients about, let's reflect on how much you're actually drinking.
Yeah.
And there isn't much debate about heavy drinking is bad for us in all sorts of ways. If we can get people from heavy to moderate, moderate to light, that's going to improve their health. There's no question about that. So I think a warning label, I worry about the panic and misinterpretation, but we can wrestle with that as a society and in our clinics as primary care docs with our patients.
Other countries like Canada and the United Kingdom, they already warn citizens about the health hazards of drinking any amount of alcohol. Dr. Ezike, why do we have a different policy in the U.S.?
Yeah, no, I mean, it's for, as a sovereign nation, we can determine, how we will notify or share information. I think this can be one tool that could raise the awareness, improve the education of our citizenry around something that's very critical against, allow them to make more informed choices. I think there are many ways that we can raise education levels around this. This is one way. Obviously, just having the discussions, maybe teaching it in school health classes, having, different information ads, social media, TV. There are lots of ways to get the information out, but
Right.
it is important to make sure that we're informing the public about information and links that have been identified.
Yeah. And Dr. Didwania, I mean, I feel like some people listening are still trying to, maybe assess their own situation. And as you talk about moderate and heavy and light, trying to figure out, where do I fall? So I'm curious, I mean, does drinking more than the recommended amount during the weekends only, right? Does that count as heavy drinking?
It's a great question. So the studies on moderate drinking don't really parse out what 7 days a week means. They don't say, is it one day, one drink a day, and that's the definition, or is it 0 Monday to Thursday and 3 on Friday, 4 on Saturday? We don't know if those are two different forms of drinking that have two different health effects. What's important is heavy drinking, more than 14 for men, more than 7 for women, has all sorts of negative effects, not just the cancer link, but many other health effects. Binge drinking has its own definition, and that's having more 4 or 5 drinks within a 2-hour time frame. Excuse me, more than 3 or 4 drinks in a 2-hour time frame for women and men respectively, and that has its own health effects: neurocognition, alcohol poisoning, whatnot. So if I'm sitting with my patients in primary care clinic, and I'm hearing them describe their pattern of drinking as heavy as binge drinking, I'm worried about alcohol use disorders. And that's where I want to kind of start educating them and working with them on their health.
I see.
This moderate category is a little bit of that gray zone of, okay, we have enough information to say, let's keep reducing from there. But the pattern within that is a little bit up for debate.
Yeah, thank you for clarifying. Dr. Ezike, I mean, getting a warning label on a product, as we've been discussing, it's a complicated process, right? Congress has to approve all of this, don't they?
They do, and is the juice worth the squeeze is the question.
Yeah.
That's for someone else to decide. I know that even when you put up caloric information, at restaurants or at fast food even chains, we know that has an effect, that you're forced to see this information that can affect the subsequent choice that you make. So we know that there can be a benefit to that. We also know that, when something is on everything, people have a way to tune things out. So, how much of the benefit is achieved over what period of time, I can't
Right.
answer all
How
that.
effective are these labels? That's another question, right?
Right.
We consume other products too that we already know are linked to cancer. I'm thinking of red meat, processed meat, but there's no cancer warning sticker in the meat section or on the deli counter. Why not, Dr. Ezike?
No, those are good questions. There are a lot of things that we know are linked to cancer. There are a lot of activities as well. And so thinking about how you determine which ones you have to highlight, I guess this one being, the third most prevalent risk factor that you can be aware of to help prevent cancer, that gives it a little bit of status,
Hmm.
because you're talking about tobacco, followed by obesity, followed by alcohol, kind of uh, raises this specific risk factor in the amount of connection that it has to cancer. We're always talking about, we want to cure cancer, we raise money to try to fight cancers, but being able to prevent it is actually the goal. And so
Right.
being knowing what you can do to prevent cancer should be something that we're all excited about, giving people the tools to be able to do that.
Dr. Didwania, is there an argument to be made that life is just more enjoyable with some of these products, and joy contributes to a healthy life?
Oh, there's certainly an argument for how to include joy, social connectivity, social bonding over having a drink with somebody at a holiday party or at a social event. It's very hard to quantify that. And so that's where I think the most important thing in the news that's coming out in this Surgeon General's report is helping the public understand that this link is there,
Hmm.
and it's about education. So an individual can make a more informed choice about understanding if they're a regular drinker, what the implications are for their health. And it does create some tension or stress for an individual to say, okay, now I got to worry every time I go to a party and have a drink. But we can work with that. We can help them understand, hey, you don't need to be in a panic to be a light drinker.
Yeah.
If you understand your risks are low and you accept them and weigh them against the joy you get out of alcohol. If you're an individual that wants to be conservative in your health, you're worried about cancer risk, maybe there's a family history, maybe there's something else in your health profile that has added risk, you might say, I do enjoy a drink, but now that I know it's not worth it, and I'm going to start to cut back a lot, if not completely abstain.